Still around 130 delegates are here, all pepped up to join probably the future faculties of dentistry who is going to lead this science. From the very onset, I would like to congratulate the team ANNOOR, who has brought in so many of the first year PGs together of different specialities and disciplines, which clearly sends out a message that future dentistry has to be united in many ways. That's what myself and Jiju was discussing. It should not be a field wherein an ortho has been separated and learned some specialty-wise procedures, and endo is going to teach something else. It has to be all joined together in one point of the studies, and that study is what is being given so much importance in this orientation program, that is research. And I've been honored to give a lecture on one of the sought after aspect of research, that is a short study that would definitely give some kind of a uniformity in the teaching of post-graduation in at least in our country. So having said this, I bring wishes from Department of Periodontology and Oral at Royal Medical College. And coming into this topic as such, I would like to have a small introduction on the reason or the prime purpose why I am here. This is to experiment myself and to understand something on research during the preparation of these things. It so happened that a month ago when Dr. Jiju called me up and said, you're coming to ANNOOR Dental College as a speaker. So naturally this is going to be a reaction for a person who is into the other field of practice, a general practice or teaching in one of the institute. He's been called to this college as a speaker. Definitely there's no point in denying the call, especially from a person who is a benchmate of mine from the first year BDS time. This happened very soon when Dr. Jovi called up and said, the topic which you are going to speak is on research. Then suddenly that butterfly comes from the stomach, and a person like you has to speak on research. Definitely then we call up Jiju itself and says, this is not my cup of tea. Research can't be spoken by a person who is probably into a clinical side and probably an academic side. You should be inviting somebody else. But this person whom I spoke to regarding denying the topic is one of the best motivational speakers in dentistry and known to be since last more than 30 years. And he could have done nothing better than this. He said that biggest lie, that you are the right person to do it, and even Cindy was saying the same thing. You are the right person to teach this to the first year postgraduates, and this is what I heard, and slowly you get motivated by the Hardman effect, and then finally even you are convinced, yes. So you are finally convinced that you are the right person to conduct this thing in this place. And then you go back and start preparing on this absolutely unknown topic of what is this short research all about. If you're talking about dissertation, fine. If you're talking about library dissertation, fine. Now, what is the big deal about short research? Why should I know about it? Why should I teach about it? But then finally today morning I arrived in this place all pepped up to take a class on this particular topic. Then finally this is going to happen in the next 1 hour time. They are all sitting there motivating me to take classes for you people. Sad affair. And finally this is going to happen with the delegates in 1 hour time. They're going to get smoked up. And this is going to happen with Joby or Jiju, I don't know. Now, there's no point in laughing. You're laughing at the professor, please. So, but this is of course the condition. And if anything goes wrong, this disclaimer, these two gentlemen are responsible in the next 1 hour. If at all, by any chance, if I take away any of your knowledge, if I unlearn you by any means, then it's not to be me who should be blamed. Then there are two people sitting over there behind, you can take over there. Now, This is the point. Every PG guides over here, they're all postgraduate teachers. They've guided so many projects. Projects in the sense, if you happen to check their credentials, they would have all helped or guided or assisted or whatever it is in the PhD, thesis works, a library dissertation, lot of short researches, position review, pilot studies, everything. All these postgraduate teachers over here are the ones who are guiding you to have done all these things. Still, why are we hesitant to address ourselves as a researcher, a research consultant, or a scientist? If I consider myself not a researcher, then who is a researcher? Now, this one particular ratio and such data and all will be fed to you during your IDA period. IDA period, I mean to say, the conferences where you attend as a delegate in Indian Dental Association or any of all those things, because you are all postgraduate students, you have at least experienced this one about the ratio. The doctor-patient ratio was this much at that time, then it increased or decreased to this much. Then definitely a base salary of a dentist also would have been discussed to you. Fantastic to know about this thing. I just learned it yesterday that we have got a base salary of a dentist up to 4,258 per day, it seems. But the most fascinating thing is that a general physician is up to 3,596 per day. This is in India. I am giving you an idea regarding the scenario, how much you can earn being a dentist in India. But you know, the Indian contribution to global dental research, this was very much interesting, much more than what you learned about the dentist ratio with the population here. It's 1.21%. And what about to Asia? We contribute 2%. So this is something that reflects this kind of a situation where people are busy milking the cow, but nobody on the other side where they have to feed something to the cow. Now those two things, what I said before regarding the patient-doctor ratio and the salary, the salary what we compare with the general physician. But if you see the second thing, then it is something like this that's happening. So what is to be fed to the cow is not being given. Unless and until you have an increase in percentage in the research side of it or contributing to the science, you cannot expect anything to happen in that science if you keep on milking the cow. Now, this one thing, the most universally accepted, dignified, glorious professionals are scientists. We are all proud of our ISRO scientists. We are all proud of all those people who have been labeled and black and white photos which we have seen in the textbooks from the school days. Now I'm sure about this one thing. Every MBA student here wants to be known as one scientist. It's right from our school days. We were all fascinated by scientists. What I understand is, I used to say the most dignified group of people in any specialty are teachers of that specialty. Do I definitely over a period of time, or in the last 10 years or 12 years, I changed that statement. The most dignified, the most respected professional of any profession are its scientists, not teachers. Now, even we are all professors also, but we all shy out when we are called as scientists. Definitely get a feeling that it's not me who's being called from behind. What is the reason? What could be the reason that even personally myself or anybody shy out being called as a scientist or a researcher? It has to be attributed to these two people. Definitely. You ask your grandparents to name two scientists, name of two scientists. Want to say the same name? Of course. You ask your parents to name, you ask your teachers to name two scientists' names. Definitely they are going to say the name of these two people. Who are they? Yeah. So even if you ask your children to name two scientists, still they will tell these two names. Here there is a big danger of this particular scenario. I have hardly seen an Indian scientist among my school teachers or college professors. Have you? You have heard about Einstein, Newton and all those things, but this is one particular thing which has to be focused on. I follow a culture that condemns every Indian research work as substandard. Have you felt this? That's an Indian study. Leave it. Now, scientists and researchers are textbook figures, which they carry test tubes, they pour one color into the other color test tubes, and all those things kind of pictures comes to my mind when I talk about a scientist. They all look very smart. They all wear that Western outfit and all those things. That's how we figure scientists as. Till today, I have not met an Indian scientist. I don't even know how does a live Indian scientist look like. I was never asked to follow textbooks written by Indian authors also. This was a scenario. There was a fine introduced in our college for those people who read Indian textbooks. Does it happen still? I don't know. I still have not seen an Indian Streptococcus. I have not seen an Indian P. gingivalis. All I have seen are all foreign P. gingivalis and foreign Streptococcus mutants. There is a separate section for textbooks written by Indian authors in our library. Do you people also have it? All the other foreign textbooks are kept together, but Indian textbooks are kept separate. No, there's no crime in it, because that's how Dental Council of India have asked us to prepare the library. They have to keep Indian books separately. I still have not worked on a worthy Indian dental material in my clinic. The other day, when Fuji material stopped their type 1 glass and we were in a dilemma of should we close down the practice or not? So we were so much dependent on these foreign materials, foreign gadgets and foreign equipments that if it doesn't work out to have some kind of your export-import policy change, then probably you have to change and think about closing down the clinic itself. My country but has the maximum factories that produce dental graduates and postgraduates. Yes, we are very proud of it. My country conduct and print and bind a big, huge number of postgraduate dissertations every year. That simply shows every year in 2020 period we have seen 6,814 postgraduates like you coming out. 26,000 undergraduates coming out. It's a huge production from any factory possible. PG dissertations were taught to us, or it was made to believe that all the postgraduate dissertation work what you're doing today in MDS are all preparation to do your future studies. So then, what does that mean? Future studies after MDS, I can think about PhD. So what was told to me is, whatever are you working on, your thesis work of post-graduation, your thesis dissertation work of an MDS period are things which you have been prepared to work upon when you are doing an original research tomorrow. So that means unless and until you are going in for a higher education, the dissertation which you are doing right now is a waste. And you ask somebody to do a post-graduation after your MDS, to do a PhD, anybody will run away. If you people are given a degree of post-graduation right now, do you think you will ever opt the chance of studying for another 3 more years in a college? No, you will just take the certificate and you will just run off. So, asking anybody to do a PhD after MDS is going to be this scenario. Now, what is the fate of this MDS dissertation? Naturally, when this is for a preparation for something to be done later, what will happen to that preparation which you have done, spending so much of money, so much of effort, the manpower, all those things, all those humiliations you have gone through during your postgraduate dissertation work and all those things. The fate is absolutely, once it is accepted by the university, whatever is being taught to you in the last one day or today, further to my talk, all those things, whatever you prepare in dissertation, preparing that synopsis, everything, these are all being prepared for a university to accept it. If university accepts it, it's finished. If it doesn't, then definitely you have to go in for further working on it. Otherwise, once they accept it, and what I understand is in Guhas, there are hardly any dissertations which are rejected nowadays. They weigh something in the beginning. Nowadays, they don't reject anything at all. So, all these preparations are being done, sent to the university. University send you a note that it is accepted, it is done, finished. It just lies in the cupboards of some reviewers, it will be a copy will be there in the university store, one copy will be in the department library, one copy has to be given to the guide, 100%, because that's going to be our credentials. So that is to be given to the guide, and the investigator's personal connection will be having one thing till something happens to it. Some buried alive dissertations which had the potential of still some life inside it will definitely be reborn. A research work published from becomes a reference to other research studies. So this is the only way a research work, whatever effort you have taken, can be somehow rewarded. It has to be reborn from the RIP condition, and the true rebirth of a dissertation happens when it is published. Once it is published, it becomes a reference for other research studies. This is one thing what I want to focus on throughout my presentation. Your study is to be continued by other researchers. So basically, a good research work done today should link whatever research was happening yesterday to the possible research that will happen tomorrow. Your dissertation should be a link between these two. What happened yesterday in that particular research work to what is possibly happening tomorrow. Your research work should be published, and it has to become a link in the chain of the growth of science. So this particular aspect, you have done some extraordinary work on one particular aspect. It is definitely a continuation of what was happening yesterday. This has to continue to tomorrow. So your research conclusion becomes a link between yesterday and tomorrow. If at all it's cut in between, then definitely all those things what we discussed prior to this will happen. If you are a continuation as a reference, then definitely it's an achievement. The teaching of a teacher is of relevance only till what he taught is changed by new researchers. Till only a teacher, whatever a teacher speaks, whatever a teacher teaches you is of only relevance till that particular thing is being changed by new research conclusion. Normally what happens in a teaching institute is a teacher will teach you things taught to me by my teacher, which are things which was taught to him by his teacher, which were all things taught to him as the only truth that exists in the world by his teacher. So his teacher had taught him in 1950s, which was taught to my teacher in 1980s, which was taught to me probably in 2000 is what I teach you in 2023. There is nothing that has changed over a period of time because I am very loyal to my teachers, like my teacher was very loyal to his teacher, like the one he was to his teacher. A procedure done by a clinician is correct only till new techniques come in. So you cannot ask a patient to come after 20 years to get some treatment done where things will be discovered at that point of time. You will do something at that point of time which will be absolutely in competence with the present day scenario or the growth of science. When somebody comes for an extraction, because of a mobile tool, can you just tell him, come after 20 years, there will be some technique discovered by somebody which will immobilize your teeth. No, you cannot do that. So all those things what a clinician is supposed to be doing today is not the end of it. He has to keep on refreshing and understanding one particular aspect of it that is dependent on research and has to follow the evidence-based dentistry, which are the sole responsibility of the researchers. A teacher without a researcher's attitude and updating himself is a criminal. A teacher who is not following the research outcome of whatever is happening in the entire universe, who cannot update himself, is a criminal. A clinician who doesn't follow a research trend in his field is a cheat. You tell patients this is the only thing possible. No, you cannot place implant in this case. Why? Because I don't know it. That's what the reason is. No, that should not be the reason. If there is anything that can be offered to the patient which is out of your hand, definitely you have to follow the research protocol and the research is happening in the world. MDS training makes you approach academics and clinical practitioner in a researcher's way, the critic's way. This is one thing that has to go into your mind. You all should be not be a rebel, but you have to be a critic of everything. Criticize anything and everything. Unless and until your criticism is going to work out as a success or a failure, don't give up. Criticism, creative criticism is the mantra for anybody who has got a research attitude. Ever thought you will be doing research when you joined for post-graduation? Did you ever thought that I'm going to do some research? Then all these exercises like journal review, seminars, library dissertations, pilot studies, synopsis preparation, thesis, basic science project. If you have done any of these things properly, then definitely you have got the right to be called a researcher or a scientist. You don't need to grow your hair like Einstein or put that thing over your head like Newton to be called a scientist. If you are into this, then understand one thing. You are a scientist too. Now, today the advanced dental education is more focused on these particular things. Gadgets. Gadget science. Anything you want, there's a gadget to probably substitute you as well. So, gadget science are given more importance. All those kind of things are being taught in short-term courses. You don't need to join for orthodontics to learn a fixed dental, whatever the treatment is. You can join a 3 months course under somebody and learn the same thing. Why should you spend your 3 years of precious time wasting your time probably to learn this? Mere technology and gadget training made every clinician prosper, no doubt about it. This is probably one aspect why you have selected these specialities for you in your post-graduation. Ask somebody which subject you want to join for a post-graduation after your probably entrance and ortho. Now, why ortho? Why ortho? Why ortho? Most money-making thing? Or is it because you don't know anything about ortho, so you joined and this one answer has been repeatedly told to me for several number of years. I didn't know anything about perio, so they all joined for perio. I didn't know anything about ortho, so I went and joined ortho. Then you should be joining BDS once again, not MDS. Just imagine specializing in a subject which you don't know. That should not be the attitude. And if you see somebody who has joined for oral pathology or oral medicine or public health dentistry, which I was having a talk with Dr. Venki, such fantastic specialty science, nobody wants to join. Now why? It's not a clinical subject. It was taught in the canteen. It was not taught during your undergraduate time in the dental classrooms. They were all taught in the same. Why not oral pathology? It's not a clinical subject. What nonsense. What subject is that then? If oral medicine is not a clinical subject, then which is a clinical subject? If oral pathology is not a clinical subject, then which is a clinical subject? Unless and until PhD people or community people give you the data, how are you going to practice? So we have got a weird idea regarding our specialized the subjects which you have probably chosen for specialization. A need for a dentist to operate these things are going to be questioned very soon. I don't think these gadgets, anybody of dental field will be associated with the research or invention of these gadgets. It will be engineers, right? If engineers know to make this, engineers know better to operate it too. So tomorrow, definitely in another 20 years time, it won't be a dental crowd which will be learning this orthodontics, composite restoration, all those gadget things. It will be engineers. Definitely, they will call it probably bioengineering in the beginning. Slowly, they will take that engineering off and they will call it biodoctoring, doctor-engineering, whatever it is. Definitely, they are going to slowly take over medical science. Probably in a better way. Postgraduate curriculum should shift from technological training to research-based training. Now that word training is very, very important. Training is not just learning. Training is repeatedly learning the same thing. A training is a word that has to be applied to postgraduate in PG teaching program. Training of techniques and technology creates consumers. Am I right? a new material being introduced into dentistry. You go and ask your professor, sir, how can you operate? You read the instruction manual given by the manufacturers. Then why do you need a guide like you? They come and ask me in Perio, like, sir, how to operate on this material. There will be a pamphlet given along with that, you read it. Immediately, this girl, I really doubt she might do it also. She might ask, then why should I come and join under you? I should have joined under somebody else. So it creates consumers, whereas research training creates authors, scientists, entrepreneurs, and authorities in dentistry. Now, this is where I welcome you all for doing post-graduation. It should not be just a mere technological training that can be done by anybody, trained by anybody, learned by anybody also. So, little more than what we have heard about research. Research is not about discovering new things. Research is not about publishing articles or writing books. Research is not at all about gaining awards and Nobel Prizes. Please believe, those two are not the only scientists who have ever lived or will be living in our minds. Research is an attitude. It's an attitude. Research is an attitude. The other day I gave an example in the classroom that dropping a chalk over here, then somebody in front saw it is a chalk. The one person sitting behind never saw what was dropped here. This girl had to yell out saying that there is a chalk dropped here. That lady was happy with it. There ends the research attitude. If that person was not happy, they'll come and check it what was dropped here. So this is researching. Researching the same thing that exists here is research. Research is the way you approach things. If you're happy when a lesion is being seen, you go and ask your teacher, what is that? He'll tell this is oral submucous something, fibrosis or whatever it is. You're happy with it. There ends the research attitude of a person. There, that research attitude is killed. If at all you are satisfied with this. If you have still some doubt left with you, then you have a researcher inside you. Research is the way you understand things. Research is the pathway to understand things. Research exposes your limitations. This is the main thing. Research exposes your limitations. So, basically, research in its highest expression is an open-minded inquiry of truth. Because the truth never comes in front free. You have to explore it. So that exploration of truth is what is research all about. When somebody said Earth is flat, you all believed it. That would have been the end of it. When somebody had a doubt, no, there is another possibility of understanding it, and that person went through that, and finally, what did he reveal? Earth is round, which is more closer towards truth. Now, somebody else will go and travel somewhere and look from there and find Earth to be something else, some other shape, then definitely you'll have to change accordingly. It's an attempt to research things of your own, what others have already searched and concluded. There is no word of conclusion in research. You can never conclude a topic as such. You can conclude your study. You can conclude your study, but the topic cannot be concluded by anybody because it's all dependent upon who is going to operate on it. It's an attitude to experiment your own intelligence. So the intelligence which I possess, which I understand, the way I understand is totally different from somebody. So somebody has done a work on that particular thing. Now let me also work on it. Probably the outcome will be totally different. Now let's join this whole thing and discuss, and let's find out which is a better truth among these two conclusions. Research is an inborn attitude. Training can only customize it. See, a non-researcher eating food. And probably this is a conscious researcher experience eating. Research. Yeah, good, fine. So this is research. You don't need to be Einstein or eating that kind of food. You can be a Malayali eating this kind of a food to become a researcher or a scientist. So believe me, even that person doing this particular thing has to be put under the category of research. Whatever this person is doing, this should be put under the category of habit. Habit of doing something which you are not involved in it. If you are involved in something and doing something, definitely there will be a conclusion out of it. Research is only this thing. Probably eating is research on your dining table. What mom was doing in kitchen was research. It included everything. Whatever the research methodology probably yesterday was told to you, everything is there in your kitchen. Go back to your kitchen and check what is research methodology. Every living being is born as a researcher. You know that? If we are all born scientists, see this. That fellow is doing a huge, fantastic research. Research on whether this person is father or not could be another matter. But whatever it is, he is all ready to take up this research topic of being a child for that particular. Who is looking at me? Is that a nurse, doctor? No names involved, but a researcher is there. And he progressed with this. What is happening in that other room? So even that fellow is doing a research, that child is doing a better research than many dissertations which people are doing. Fantastic methodology, right inside the mind, no bias, nothing. And you're not going to get anything out of it also. Only to know what is happening in the other room. That is all I will need to know. The purpose, the rationale, the aim, the objective, everything is there on that face. I don't have anything to do by knowing it, but I will do it. This is what is research. Unbiased approach. Now, all those inborn talent of your scientists ended up in this particular room. When a teacher walked into that room and said, A for apple. A can't be nothing else. Finished. There ended up. So what is happening in that other room? I don't know. A for apple. That's all I know about this particular education. This is what you have to study, because this is from where I'm going to ask you questions, and this is the answer you are supposed to give. You say anything else, you will be failed. Where is researching now? All those inborn thing is gone, finished. Anybody ask me even today what is A for? Apple only, astronaut. What about those signboards in front of movie theaters? Nothing. They are all nothing. A is only meant for apple. They are spoiled, killed, everything. And again, when you went into other classes, you had common uniforms, you had a common way of learning, you had a single textbook from which you all learned. God. There came a uniform, there came an attitude which is competitive. A competitive person can never be scientific. A competitive person can never become a scientist. But few of us maintain the quest for research. Definitely, we still somehow, even with all those things what teachers have done on us, we still maintain it, and those people succeeded in what is called as a research. So all those things what was taught to you by your teachers, saying that this is the only thing that you should study, we all were ready to fail also, but we will not study that. So those people could succeed probably to this level. Having such a long introduction of my topic, I am coming to that slow little things what need to be learned by you all. Short study, how to select yours. This is what I said in the beginning. How to select your short study. After knowing all those things, if I tell you one particular some shortcut or anything to select a short study, it's going to be again the same thing what a teacher does, a criminal thing. Now, a genuine study, thesis, LD question or a short study, they are all product of a genuine question or a doubt. A short study, a long study, a dissertation, library dissertation, or research projects, basic science projects, or anything of that sort, they should all be a simple answer to your doubt. So to select your short study, you have to decide what is my doubt. Why is amalgam, silver amalgam, or let me put it another way around. Why should you make a reverse curve and all those kind of preparations for amalgam to sit there? Because otherwise amalgam will come out, right? So what about the design of caries? Are we really bothered about the design of caries there? Are we really bothered about the drawback of a material which otherwise won't sit there? When you make a cavity cutting, we are not bothered about the real caries, shape of a caries. We are more or much bothered about how your material is going to stay there. So you have to prepare a caries which is 0.5 millimeter diameter to a diameter of 1.5 or even 1.8 for the amalgam to sit there. Even if you don't have a caries on a tooth also, if at all you have to place something in that area has to be beveled, so that the composite will get better whatever it is, your surface area for it to sit there. So whatever we think about preparing many things which can come out as a doubt should be asked to a guide. And if the guide says, I don't know an answer to it, this is the time when the real research question comes out and you have to do a research. Most worthy research you have heard of were never done with a systematic approach. Many things or many big discoveries which we talk about, they were all accidental discoveries. Answer to simple questions like, he had a great fall of apple on his head. Right? He asked himself a question. What was the question? Did he immediately register his name in Kuhas University or some other university saying that I'm going to do a dissertation upon this particular thing? Nothing. He had a great fall. He immediately could figure out a question out of it. The answer was gravity. Do you agree to this? Did he go into any kind of a systematic protocol of research? He wrote down that, he wrote down a synopsis and sent it to some university, then started studying? No, for sure, no, for sure. But the problem is, several things have fallen on my head, but I never had such a question with me. I never thought about like, why did this fellow fall on my head, or why did that fellow fall on my head, why did that thing fall on me, why did I fell down? Man, I never had any question. If something fell on your head, definitely it will pain. There's no time to ask a question about it. It will be always a complaint about it. This fellow had gone out with his wife for 2 weeks vacation somewhere. When he came back, he found in his petri dish what? What did he find out? There's something else growing than what he had cultivated, right? And he asked a question to himself, what is that thing that is growing next to it which is killing the other one? I prepared something in the petri dish, and when I came back, something else has grown bigger which has killed the other things, right? What was the answer? Answer was antibiotics, right? We all have left our dining plates without washing for weeks together. Did we have any question like this develop in your mind? No. So the only difference between Fleming probably and BINIRAJ is no questions for me. I know things, so I don't need to have questions out there. This fellow had kept some chamber inside rabbit's long bone, and after some time he fractured it and he saw that thing is not coming out, right? He had a question to himself, why is that chamber not coming out of the long bone of rabbit? Answer was dental implant, right? Osseointegration. Now the thing is, my question would have been, why did he place such a chamber inside the rabbit's long bone? Am I right? Probably, my doubt would have been that what was that fellow doing with the chamber inside a rabbit's bone for? That fellow's question was different, answer was quite useful to others. All these things like X-rays, anesthesia, pacemakers, Botox, they were all answer to a research question. Not done, it's not a product of a well-structured research work what these people have done. What made these accidents turn discoveries? Anybody? A research question. So a short study or a long study or anything has to be selected, has to be made materialized only based upon a question which arises from your mind, which definitely is going to be some useful to you and for others. A good study or research starts with a genuine research question. A critical issue in dental research was just one thing earlier, which we already mentioned, the lack of genuine research question. This is what was lacking in research in our country, because we always knew something and we believed that is true also. So this was the only thing that was lacking, and that was the thing that was doing all the harm to the research in the country. Now, a second thing has come up. Any takers? One thing was lack of questions, but now there's a major thing that is following it. Availability of enough and more answers on internet. You have a doubt, go to the internet and ask. Definitely that fellow, that lady will give you an answer for it. You're happy with it, finished. So again, there was a question that was a requirement. Now their answers have become a nuisance. Now, what happens after research question is decided by a researcher? So, what would have happened after Mr. Newton had a great fall of apple? What he would have done? Did he took out a piece of paper and wrote gravity in it? No, he made definitely a research question. He made a research. What was the research question? What was the research question? How did an apple fall down? Whatever it is. Whatever the research question you would have formulated, you would have your own idea regarding it. Now, the presently existing hypothesis basis possible null hypothesis. The second thing, what you are supposed to do. When you have a topic or a doubt in mind or a research question in mind, a doubt means two things or more than one. More than one data makes a doubt for you. Otherwise, answers are definitely there on internet or from a guide's mouth or from your colleagues or from textbooks or from anywhere. You will get an answer. So, existing hypothesis or alternative hypothesis means the knowledge regarding that particular thing or the answer regarding that particular thing that is existing now. So that has been documented and kept. This is what is alternative hypothesis. Your research question is very much in tally with the alternative hypothesis. But a null hypothesis has to be developed. Unless and until there is a null hypothesis opposing alternative hypothesis, there is no study. When I tell you it is day outside and you people agree to it, there is no study. There is no possibility of a study. When there is a counter argument, there starts a study. Am I right? Dr. BINIRAJ is standing on this platform. Alternative hypothesis, existing hypothesis. Dr. BINIRAJ is not standing on this platform. Yeah. Now there is going to be an argument, right? And if at all that not standing is proven to be wrong, then the other alternative hypothesis will stand of its own. If at all the second statement becomes correct, I never said Dr. Josh Paul is standing on the platform. Null hypothesis is not that. When alternative hypothesis or existing hypothesis says Dr. BINIRAJ is standing on the platform, null hypothesis is not that Dr. Senni is standing on the platform. Null hypothesis should be Dr. BINIRAJ is not standing on the platform. That's all. Otherwise, you will get deviated and you will go unattended ways of different means and ways you will reach nowhere. Only one sharp thing and only one sharp way to oppose it. It is not. That's all. That is what is null hypothesis. Then let there be a fight between null hypothesis and alternative hypothesis. Let that thing goes on in a systematic way. It gets carried out. One point you will realize null hypothesis is wrong or alternative hypothesis is wrong. There you will get an answer, right? And the answer is probably Dr. BINIRAJ is standing on the platform, right? But it would have been nothing or a study material at all if at all a null hypothesis was not there. Am I right? When I say standing here, it could be sitting here also. So there can be another null hypothesis versus an alternative hypothesis. So it has to be disapproved, rejected or nullified to establish an existing hypothesis. So that means somebody says something, the other person doesn't oppose. That becomes a hypothesis. When somebody says something, there is one person, brave person to oppose it. There will be a study going on this subject. Probably that person will be proved wrong. This is what is the basis of research. An alternative and null hypothesis is done. Then what? We need to clearly write down or understand a background of this particular understanding. When I am standing here and I said an alternative hypothesis or existing hypothesis saying that Dr. BINIRAJ is standing on this platform, there is definitely a background for this, right? You people are all sitting here for some conference. I am standing here for to deliver a speech. All those things have to be said. They all come under background. So that gives an understanding that this person is standing here right now for that purpose, right? So somebody is trying to prove that this person is standing there for this particular purpose. So that is the background of this particular existing hypothesis. Now, once you have written a real good background, you can you can slowly churn it down into a need of the study. A need of the study. If there is no purpose to the whole world for me standing over here, then why should you do the study now? So unless and until you have a need, a purpose for your study, don't go forward. Don't move forward. You're wasting your time. So when somebody says, I'm standing over here, and when somebody says, he is not the one who is standing over there. Now, is there any purpose for this argument? If not, please stop it. Let's go and argue with somebody else. A need for every research work that you do is a must. A need has to be there. Then, once that need is done, or when Newton could figure out a need for knowing that particular thing, what could be the need of knowing why things all falls down? That could be something, right? So that he can explain numerous principles which later on came as laws of motion. So that was what he was aiming. If at all a particular thing has been proven, if the secret behind things falling down is revealed, I can explain so many things which cannot be explained by others. A need arises. So definitely that study has to move on. Now what he would have done probably after that, definitely he would have gone and asked the other teachers or other people, why are things falling down? Am I right? Definitely. It's not that he's going to take a paper and write gravity in it. He would have definitely gone and asked others. What is that? He would have gone and referred books. What is that? Review of literature. Right? So he went and checked for the review of literature, what is available in the literature regarding things falling down. If he was happy with it, he would have written a library dissertation. That research of gravity would have ended up in a library of books, or it's going to become a library dissertation. But he could figure out certain limitations or lacunae in the information given by others. Review of literature giving rise to limitations of or lacunae in whatever you have. What was that? Somebody said it's because of the lunar pull that things falls down. That was existing probably that time. What was existing at that time, I don't know. Probably that teacher of his would have given some explanation, right? Why things are falling down. Something he would have said. So, that's all because of that particular thing. It's all because of ocean pulling things down, that things fall, whatever it is. But he could figure out some limitation in that particular knowledge. A limitation or a lacunae. What happens? You have to take up this particular study as an original study in order to overcome the limitations or lacunae of the present study, whichever is there. Whatever your key article which you have selected and kept regarding your particular study has got a limitation or a lacunae which has to be overcome, right? That becomes the rationale for your study. Research question, alternate hypothesis, null hypothesis, the fight starts. Okay, introduction comes out, need for the study, need gets developed into review of literature, whatever is there, we'll go and check it out. If there is everything fine, then it's not an original study at all. If you find some limitation or a lacunae, you go into a rationale. So a rationale is what? Rationale is a study, a need to be conducted. You have to conduct a study because there is a limitation or a lacunae in the previous review of literature. Is that clear to you? So there is a rationale behind your study. Once there is a rationale is being set, you need to know, you need to have an aim and an objective for your study. You need to have an aim and objective, just bear it in mind. And once an objective is set, what is an objective and aim? I'll just brief it later. An objective is set, you need to have a methodology for each of those objectives. A methodology, how you are going to approach. A methodology, how you are going to approach. Aim, Master of Dental Surgery in Conservative Dentistry. Aim, Master of Dental Surgery in Periodontics. Aim, Master of Dental Surgery in Oral Pathology. Aim, Master of Dental Surgery in Oral Medicine. Aim is Master of Dental Surgery in that particular subject. Objective. Fulfill the requirements as set by the university. Right? First objective. Second objective, clear the university examination. Two objectives. What will happen now? MDS orthodontics, MDS conservative. So did you do MDS conservative dentistry? No, I did my objective. I did my objective of fulfilling the requirements to complete the degree. I did the objective of writing an examination and passing it. Naturally, degree happens. Aim, Trivandrum. Objective, prepare your journey, board your journey. What will happen? You will reach Trivandrum. You are not going to bring Trivandrum to Muvatupura. You are not going to bring or take Muvatupura to Trivandrum. Only thing is, whatever you do becomes your objective. And whatever is to be done becomes your objective, whatever happens becomes your aim. Now, how did you do this objective? What are the requirements in the syllabus of completing your orthodontics? There will be too many things, right? There will be too many things to be done in Prof, too many things in oral medicine, too many things in oral pathology. They are your methodologies, not objectives. In order to fulfill the requirements of the department or the university in a particular science, what you do in your department are all materials and methods. Clear? That's not objective. That becomes the way you work out objective. Once your objective is met, you will reach the aim. So now detailed methodology, then comes an observation. This can be better understood by knowing a football match. A football match. After the football match, one team win with a margin of 1-0. Okay? What is the observation? Observation is one team scored 1. The other team scored 0. Right? What is the result? One team win. Right? Observation and result is totally different because result is to be analyzed statistically. 1 is to 0. 1 over 0 is not a big margin, right? Is that a big margin? No. The other team is also not bad because they played for 90 minutes and they could score only 1 goal. The other fellow also played for 90 minutes, they could not defend 1 goal. No, the difference is not a huge difference. It can happen the other way around in the next match also, right? So a statistician would say this is not a very statistically significant result. But result is result. For football, one team won. For a statistician, nobody has won. Statistically significant. They have won it fine, but it's not statistically significant. That is the difference between observation and result. Result has to be clearly defined. Observation is what you see there. They scored this much of runs, these people scored this much of runs. Those people won. We know that. But result has to be again statistically evaluated and said. Now comes a discussion. So these kind of study that those people have done in the past, those people are going, keeping on studying in some part of the world, everything has to be discussed together. So all those people who have done similar research have to come together and discuss their results. Because the parameter which are used for this particular study could be something else. The parameter what that person would have used is something else. So let's mix and match all those things and let's come to a conclusion. So you conclude it. Once you conclude it, you will get an answer to your research question, and with that answer to your research question, you will have that particular thing down there, some application. Because you had a need, right? You had a need for study, then there will be an application. Is that clear? So let's summarize it and say, research question, hypothesis, introduction or background, need, review of literature, limitations and lacunae, rationale, aim, objective, methodology. Once methodology is completed, you will get an observation, result, discussion, conclusion, Finished. Degree in hand. So that is how things work. So right title of a dissertation can only be prepared after the completion of your project. So your title, did I mention title anywhere? No. Title has to be written now. Because a title has to be decided after you complete your study. Probably this is not allowed to you by the university, but what exactly did you make can be said only after you made it. Because all these things, all these process will finally give you a result, right? After result, how will you introduce this? After the result only you can introduce. Because a title can be prepared only after your study result. But that is not allowed by the university. So a small exercise for that. Now, if you take these questions after your study, how to prepare a title? What was my paper about? My answer is, my paper studies drug A improves the pain of patients suffering from dental caries. Got it? A question being asked. Second question, what techniques design I used? I used randomized trials. What did I study? I studied 600 cases from 6 districts of Kerala. What were the results? There was an improvement in the pain condition of the patients. So all those answers are now summed up. My paper studies, all those things are written down. Did you get this point? Ask those questions. The answers are being selected and written down. Take the keywords from it. What are they? Drug A, dental caries, randomized trials, 600 cases, 6 districts of Kerala, improvement in the pain condition. Take this out and write a sentence. This study is a randomized trial that investigates whether drug A improved the pain condition in 600 patients suffering from dental caries at 6 districts of Kerala. It reports an improvement in the condition. Did you get this point? You took out the keywords and made a sentence. Now, create a working title removing the unwanted words. This study is not required. Am I right? Not required. That investigates whether, not required. It again is not required. So what happens? Randomized trial of drug A for improving pain condition in 600 patients suffering from dental caries in 6 districts of Kerala reports improved pain condition. Now, take it out. Remove the study area results from it. Make a title. What is that title? Randomized trial of drug A for improving pain condition 600 patients suffering from dental caries. This is how you prepare a title. It should be so crispy, should not have any unwanted things in it. It should be clearly, I can give you the presentation after this probably. You can go through that. So it should clearly explain what exactly is there in the book. This is aim and objective. First objective, second objective, where will you reach? Aim. It should reach. If it doesn't, then there is something wrong. If this hall is the aim, first floor, second floor, you will reach here. So that's how objective should be written. Now, how are you going to climb to the first objective? That is, anybody? Methodology. So objectives, expanding objective is methodology, how we do it. So this is what we discuss now, a football match. Aim is win. Objective, score goals, okay fine, score maximum goals, defend maximum goals, am I right? 2 objectives. If you score more goals and defend maximum goals, what will happen? You will win. That is so crispy. So that is how the objective is. Now methodology, for defending you will have a methodology, am I right? For scoring you will have another methodology, right? That is how methodology is written. Once that is being done, once this thing is done, you will get an observation. 4 goals over 0 goals. Observation. 4 waste is 0. Result is what? Perfect result. That team is good. Am I right? You wanted a very good margin. Unless and until you really win with a real good margin, you won't accept it as a win statistically. Observation is fine. So there are conclusions like clinically it is very relevant, but statistically it is irrelevant. This is where the analyzing comes into role, so that thing has to be clear. Now, next time you do a clinical case, present a seminar, decide to read a book, buy anything, eat from a hotel, attend a conference, play a game, chat on a mobile, do in the researcher's way. What would be that research? Make a research. What am I doing? Immediately keep down the phone. Because now you know there is going to be a background behind it. There has to be a need. If there is no need, don't do it. If there is a need, do it. If there is a need, do it. Anything you do, if you do it in a researcher's way, then definitely there will be a purpose out of it. Short studies in MDS are basically basic science research projects, pilot studies, short research works, position reviews. Now what are these? Now basic science research projects could be a topic selected from the research questions and out pertaining to subjects like anatomy, physiology, because all those things which you studied in first year BDS are not enough. They are not enough to continue that study in your postgraduate level. Because the day we realize learning anatomy is for the surgery that you do tomorrow, the day you realize physiology was a continuation of physics, the day you realize biochemistry was a continuation of the chemistry you studied in your school days, the day you realize physiology is what helped you to make yourself a physician, the day you realize anatomy was learned to do surgery tomorrow, the day you realize biochemistry had all the chemicals, everything in it to make a diagnosis of a disease, the day you realize the change in histology to a pathology is what you check under a microscope as biopsy, the day you realize pharmacology was adding chemicals into the body to rectify some other chemical reactions, the day you realize microbiology is a science of friends and foes of microbes in the world, not just enemies. Probably it was all has to be mixed up in your PG time. It's during your postgraduate time where we realize microbiology is much better things also than all those harming things in the micro things here. Now, pilot studies, they are all smaller versions of your main dissertations. It's a very interesting thing, but this pilot study could be helping an answer for the research question, or it can be even added to your dissertation as a discussion work also. A pilot study, how can we do a study? Is this study feasible? A pilot study can explain this. Short research works, probably the things what you are learning in your department can be included as a short research work. This one thing is very, very, very important. Position review. This is a fantastic short study that you can do in your department, which says what is the status quo of that particular topic right now. If that subject is no more relevant to your particular thing, for your specialty, discard it. So how a position review is probably designed. You will have two views over it, then go for a position review. What has happened in this particular subject in the last 5 years or 10 years? Let's review. Let's review with the articles, with the present and past and things that has to be now discussed. And come out of some kind of a conclusion that shows presently is this topic, is the technique or anything that technology, is it relevant or not? Position review really update your knowledge. So limitation doing research in our country is not a lack of fund or time that everybody complains about. No, we are doing a research right now when I'm standing here. I'm doing a research right now standing over here looking at your faces. You people are doing a research looking at me and looking at the slides whether this is of some use or not. That is what you people are trying to research out of this. But what I understand is lack of dreams is the prime thing that holds back all of us then from becoming a scientist. Lack of a rich, good research guide, very, very important. Unless you are guided right, you will definitely land up in some situation where you cannot move forward. Because the guidance is very much required in research. A guide can make or break your research. Lack of facilities to do good researches. Our university calls for our college to get affiliated to it, but what do they give us? Exam conducting things and degree universities. No. If you are affiliated to a university, university should give us facilities to do research. If they don't give us a facility to do research, then you cannot dream about it. Then lack of genuine doubtful minds. This is the important thing, or rather this is what is being requested from you all. Get doubtful mind. So not to beware of the apples that fall on your head. Should be aware of each apple that falls on your head. There will be a possibility in it. There will be an opportunity in it. This is what you should focus upon. Let each one of you be remembered for the researcher's life in your when you lived here. Wish each one of you be remembered as a reference by your next generation. What have you done here? You become a reference. Reference for what? Reference for everything. That fellow is a reference. Don't call him anything else but a reference. He has been a reference, his work has been a reference, he was a good reference for us. Like a beacon, shining, standing alone, uphill, burning itself for those who got lost on the way, yet dare to search for a direction. This is definitely what is expected out of you people students. So with that, I thank Team ANNOOR for this fantastic, wonderful opportunity given to us. And probably we started off by having a shine out of being called as a scientist, and probably I think at least towards the end of my presentation, I could make you people convinced that you people are all scientists. Are we all scientists? Definitely, we are doing some research out there every moment. So be very consciously doing that particular thing and call yourself proudly as scientists. Not just Einstein, Newton are scientists here, even we all are. Right? You have done some justice to that topic. Thank you very much.
Thank you for the session.